So you've heard the basic content of the theory part of the webinars. Now it's important for you to know really how to translate that into proper treatment. And it's also important for you to know, in doing that, what the practical element of the masterclasses involve. There are 4 stages of the masterclasses, and I'll be going through all of those right now. So just going back, the theory of stage 1, or now we're calling it level 1, is the anatomy and the biomechanics, the 2 most common degenerative spinal disorders, stiff spinal segment and facet arthropathy, and the all-important lecture, the importance of spinal decompression. That's stage 1, theory component. That would amount to about 6 hours of viewing, which you would do at home in your own time. So what does the practical adjunct of level 1 consist of? This is a 1-day. What level 1 involves is this fine-tuning of manual palpation. So many physios are out of their depth with palpating. So many physios miss L5, as I've said earlier, and we really need to know the surface anatomy of the lumbar spine properly. We need to know what we're feeling. If L5 is the main problem level, which it is, then it's most important that we don't miss that. So fine-tuning of manual techniques, where you're all assessed and evaluated and you all show your palpation skills to everybody, and then you're corrected, kindly I might say. And I go through each participant in the class. It's quite surprising how much physios have stuff in their spine. And then I demonstrate, having looked at all of your backs, palpated them manually, so palpated them with my hands. Then I actually demonstrate on all of you in turn on the floor what it feels like me using my heel to mobilise. Then we have a patient that I see, a proper patient that I haven't seen before, don't know anything about them, and that's a process that takes 90 minutes, where I go through their history, I look at their scans, I make a diagnosis, I treat them, and then I go through what they'll be doing at home. Like pretty well every patient I see gets a back block, so I actually have to fit that in, showing them how to use the back block, what has to be done. And then I show you how to compile a treatment summary, which I dictate there and then. So I dictate the treatment summary, slotting in the photographs that I've taken of the patient, and then I show the patient how to do the back block. And then I actually read the treatment summary to the patient and let them ask any questions that they want before they go. So that's level 1. Very important to see a patient being treated with these techniques. Very important for you to see how readily patients accept being treated with the heel. As I've said before, it's really the profession that raises their eyebrows about using the heel, rather than the patients themselves. So the theory of level 2, which is the next 2 days of practical, is the final 3 stages of breakdown of a spinal segment, such as I describe in my book, Back Sufferer's Bible. Acute locked back, prolapse into vertebral disc, and segmental instability. They're much less common. What's much more common is a stiff spinal segment, which I believe, as you know, underlies the pathology of which is really the explanation for low back pain of unknown etiology, or non-specific back pain, or simple back pain, which is the name of one of my new websites. So they're much less common as spinal disorders. I see more of them, probably because I see more difficult backs. They are at the difficult end of the spectrum of what can go wrong. What's also an important part of level 2 masterclasses is tackling the thorny issue of whether you should bend or should not bend. As you would know, lots of physios have a inbuilt fear of bending. We were sort of brought up on the notion that if you bent, that you could put pressure on a disc and you could pop out a prolapse. You'll see how very unlikely that is, and how important it is to bend, because it brings in the pressure changes that circulate fluids through the discs, also stimulates the discs. The other important aspect is sitting, because sitting is so ever present in our society, how important it is to sit and what the principles of good sitting are. That's level 2 theory. Level 2 practical is more fine-tuning of palpation with the hands, but then we get onto the all-important mobilising, you learning to mobilise the spine with your heel. You'll see there's another adjunct video on why it is so important to use the heel and the different qualities that a heel can impart that a thumb or an elbow or a pisiform can't. In Level 2 practical, you'd also, at the end of the 2-day period, all of you demonstrate to me on my back how proficient you are using your heel. It's most important to get that feedback from me. We also go through the typical treatment protocols for really all of the spinal disorders, not just the most common two. We also have another in vivo patient assessment. You really almost can't have enough. It's so educational for you to see a patient being treated live, knowing how to cope with the patient, knowing how to manage them, knowing how to answer their questions, knowing how to control them if they're exercising too much, knowing how to control them if you feel they are a catastrophizer, all those things that make a very good therapist, not just a technician. And then we have a therapy class for acute conditions, and we have a decompression class for the more chronic conditions. So it really wraps up the lumbar spine, whereas you'll see from Level 3 that we go then into the less common spinal situations, such as crisis situations, really acute situations, common congenital disorders, how you treat those, the importance of posture and leg length, very important indeed, muscle spasm, the wild card, how it is that some patients hurt their back and get over it, some patients don't, and how it's the beginning of a lifetime really of trouble. Really important to discuss lifting with this huge industry in manual handling and ergonomics, how important it is that you understand spinal biomechanics and the importance of the posterior ligamentous lock and the spine being in its most stable state, dynamic state, to be able to lift. And you'll see that's quite controversial, as is the pitfalls of core stability training. So that's all in Level 3. We'd like you to do Level 3 within a year of doing Levels 1 and 2. It's important that you go off and do stuff, have your own experiences, have your own successes. Hopefully you don't have any failures. And then you come back, because there's really so much more than just learning to use the heel. It's actually putting together the whole package, as I've just said, of what a good practitioner is, what makes a practitioner really an excellent practitioner. So what does the Level 3 Practical Adjunct consist of? More fine-tuning of the lumbar, but really going into the cervical thoracic palpation with the hands to start with, and then also using the heel, particularly for the thoracic spine, managing these crisis conditions and congenital disorders, really managing them, knowing specific techniques that you use for things such as spinal scoliosis or spondylolisthesis or lumbarization or sacralization. All very important that you know how to manage those practically. Again, in vivo patient assessment and treatment, very important again. And specific self-treatment techniques for patients to do themselves at home. Remember, a large part of the whole Sarah Key ethos is that patients really largely are helping themselves. Yes, they do need mobilisation, but they shouldn't be plugged in forever to have it coming back and back and back and back. That's really not good practice. Level 4 gets into the more esoteric areas of what it is, again, to be a very excellent practitioner. Here are the theories, the theory lectures. Are you a technician, therapist or healer? I know that word healer causes a certain degree of toe curling. Physios don't really like ever using that expression, but really there is a certain indefinable essence that makes somebody more than just a technician, and I think that's important to talk about it. It also goes into the effect of the patient, of the psyche and the higher centres, and how that moderates the pain levels up and down. Very important to talk about that, as it is to talk about drugs. Patients often do need drugs. Patients often don't want to have them, but it's important that you have the help of using drugs so that you can be less constrained in what you do. And disc repair. Now, the notion of disc repair is most important. You'll see that I've written a paper on this with Mike Adams from Bristol University, and how disc healing is really increasingly being recognised as a very real probability, not possibility. And then a general recap really on movement versus inactivity, all in stage 4. So stage 4 practical adjunct consists of advanced mobilising techniques for all of the spine. How to use the heel and the hands. How to speak to patients, as I said before, how to deal with poor results if the patient isn't doing well, how you manage them. It's often the case that the patient is more difficult than the pathology, and that's really where experience, seniority, years come in, and where it's so important to give new graduates particularly a hand. Although most practitioners have their share of difficult patients, they're usually difficult as personalities, rather, as I say, rather than the pathology. So it's controlling the patient, how to progress the treatment with the patient, how you progress the treatment, how you evaluate whether you need to speed the treatment up or slow it down. Often you need to slow it down, to be frank. It is then possible as practitioners that have completed all stages, all levels of the Masterclasses from level 1 to 4, and then it's possible for you to take an exam, accreditation exam, APSKM, Accredited Practitioner of the Cervical Method. We have several of those, I think 40 odd of those throughout the world to date. The accreditation exam consists of a 60-minute written exam, practical exam of cervical, thoracic and lumbar, and 3 case histories. The case histories must have photographs of the scans, meaning MRIs, so it's not possible to submit a case history without your MRIs. Extra resources that are available for people who've done the Masterclasses. These are available from stage 1 forward, level 1 forward. Just makes it easier for you to operate as a cervical practitioner. We have my books and backblocks, which are available at wholesale prices for all practitioners who've done the cervical Masterclasses from stage 1 on, and that allows you to make a profit on selling them. There's a certain limitation on the size of order before we'll send to you. We don't send 1, I think 5 is the minimum of backblocks. The books you get straight from the publisher, but you buy those in bulk too. And we also have anatomical drawings that you can use, and of course there is a whole range of what we call exercise and information sheets. For example, the importance of sitting. So these are generic cervical information sheets that you can use, and they make it all much easier for you to be giving patients good evidence-based information to go with your hands-on treatment. There's also a video library of spinal techniques that we are in the process of filming now. They're short video clips that you download and you keep. Techniques with the hands, techniques using the heel, the spinal appeasing exercises that patients do themselves with me demonstrating or me commenting, spinal decompression exercises and spinal strengthening exercises where these are important. In due course we will be doing a video library of the peripheral techniques too, because that's level 5 of the cervical Masterclasses, where I go through all the peripheral joints. So the video library is going to be a very important part of your repertoire of resources, your library of resources. Case studies too on demand, where I'm treating patients in real time from beginning to end over a 90-minute period. So we'll have case studies for stiff spinal segment, case studies for facet arthropathy, acute locked back, prolapsed intervertebral disc, segmental instability, but we'll also be having case studies for the cases that fall into stage 3 of the Masterclasses, which are the congenital disorders and the crisis disorders, things such as acute locked back, spinal scoliosis, acute spondylolisthesis, instability. These take a while to corral together and film, but that shows you everything. It's like a fly on the wall, free-to-air television really, of the history taking, how you have to keep the patient on track, how the history taking really shouldn't go on longer than about 12 minutes. Viewing the scans, pointing out what's important on the scans, applying the clinical reasoning to why I've come to the diagnosis that I have. Again, compiling the patient summary. You'll see me actually dictating that and my PA taking it down on the computer. And then insights into the prognosis, me reading the treatment summary to the patient, and of course again with all of them, how to use the back block. I don't go into the back block for every single one, because again that is one of the downloadable videos that you can avail yourself of. So there we are. I hope that makes it all clear.